From health summit to a looming strike, the Kenya Union of Clinical Officers has announced the resumption of a nationwide strike effective Monday midnight, citing to implement the return to work formula signed September last year. The clinical officers accused the Social Health Authority of failing to implement the resolutions of a meeting held between the Ministry of Health on 4th January 2025 regarding the contracting and empanelling of facilities and clinical officers to share. The industrial action resumes after the lapse of a 21-day suspension strike notice.
Public health facilities across the country are headed for paralysis beginning Monday midnight, following the recommencement of industrial action by the Kenya Union of Clinical Officers. The unresolved issues in the return to work deal that are unimplemented include confirmation of universal health coverage staff into permanent and pensionable terms, promotion and redesignation of clinical officers, comprehensive medical clinical officers, and failure to schedule next collective bargaining agreement negotiation meetings.
The Kenya Union of Clinical Officers regret to announce that our strike will resume in full force. All public facilities, including the National Referral Hospital, effective midnight today. We urge the respective employers to resolve these concerns within the with the finality to prevent further disruption in healthcare services delivery.
The officials further lamented the non-implementation facilities and clinical officers registered under the Clinical Officers Council to SHA,
where clinical officers have been excluded from pre-authorization right, where they cannot be able to offer any emergency services to patients, and all that are registered under the Clinical Officers Act, Council, were denied empanelment.
Additionally, they took issue with the ongoing health summit ought to be involved.
Today there is a summit where they have termed it that is a consultative engagement at the Deputy President resident, discussing about healthcare workers without their representative, discussing in the health sector without their representative.
The officers have vowed to remain steady until their concerns are fully addressed. Doreen Arange for Prime Edition.